Hi, this is Alan Gassman, and I'm here with one of my favorite people, Robin Piper, to talk about things to know about addiction. Robin is the executive director of Turning Point of Tampa, which is a very well respected and decades old institution in Tampa that treat addiction. Robin, welcome.
Thank you, Alan. Thank you for having me.
My pleasure. Robin, tell us a little bit about your background and what you do and why you do it.
I have been in the behavioral health field since 1987, so it's been 31 years now, and I've been here at Turning Point for 21 of those. I am a licensed mental health counselor, a certified addiction professional. I'm also a certified trauma specialist, and I am the executive director and clinical director here at Turning Point. I think this work has always been near and dear to my heart. I realized very young that whatever I chose to do with my life, I really needed to have some passion behind, and this is the field where I ended up, and I have a lot of passion for helping addicts recover.
Very good. So, and Robin, as we discussed before we started the webinar, what we want from you today is the real practical stuff. So while I put together this slideshow doing my own education for my own future talks, I'm really here to listen and to learn from you as to what lawyers, accountants, employers, and friends need to know about addiction and what to do about addiction.
All right, sounds good.
Little advertising here. We're having a benefit on August 24th at the Largo Cultural Center, a Doors party featuring Jim Morrison's ex-roommate, Judge George Greer. August 24th, contact us if you're interested. Also, Jonathan Blotmacher, Marty Schenkman, and Jerry Hash are going to give a talk for the All Children's organization. If you have ever attended an All Children's conference, this is for free. You can sign up. It's August 29th, noon to 1:30, hot topics for a hot summer. And I'll be speaking at Stetson Law School on Friday, September 7th for 6 hours, called the Professional Acceleration Workshop. This is the fourth time I've given this program. It's a very powerful workshop for entrepreneurs, law students, and professionals. So Robin, let's start now on page 6. Tell us about misconceptions regarding addiction and common misunderstandings that people have.
Well, I think it's really important for everybody to ask themselves what they think about addicts or who they think addicts or alcoholics are, because there are a lot of misconceptions out there, and I think everybody has kind of their own misconception or stereotype that they fall into. I think it's really important to understand that addiction is a disease. It is not a moral issue. It is not a choice that people make. That addiction cuts across all races, all socioeconomic classes, all religions. It really is non-discriminatory. And people in your lives that you would never believe are addicted are. You just don't see those signs and symptoms.
Wow, so it's not just a lack of willpower.
It's not just a lack of willpower at all, and I think that the misunderstanding surrounding it really stops people from getting the help they need, because addicts are often misunderstand themselves. They don't think they can be an alcoholic or a drug addict because they could be very successful in their career, very successful with their family. On the outside, they could look like they have it all together. But they can still be dependent on and addicted to something. And it also is not a case of irresponsibility. We get a lot of family members who believe that the fix to the problem of addiction is just people growing up and learning how to be more responsible. And, I think it's wise to look at, no one's going to ever choose to become addicted. It's not a choice someone's going to make. It's happening to them like diabetes would happen to them.
Yeah, very, very interesting.
Right. And there also is a genetic predisposition. And I'm not sure if we're there. I think we're coming on to that slide about addiction as a physical disease. You know, the Supreme Court classified addiction in 1962, and the American Psychiatric Association listed it as a disease in 1965. And there is a large part of addiction that is about a genetic predisposition. Along with that, you have personal choices and environmental factors that have a large part in whether or not somebody becomes addicted. And I work with family members all the time who will say to me, if they're here because their child is addicted, they'll say, well, you know, my father was an alcoholic, but I don't drink, and now my son's an alcoholic. But he didn't grow up around that stuff because I made sure it wasn't around because I knew what it was like growing up with a father who's an alcoholic. Or a parent who sits and says, well, I have one child who's an alcoholic or drug addict, and my other child is very successful. They have the same genes. Why did this happen? So there are a lot of factors that go into it. Some of it's genetic predisposition, and some of it's personal choices and environmental factors. A large part of it is also how people learn how to cope with life on life's terms as they're developing. So every child is born with their own personality, their own makeup, and that usually runs true to form throughout their lifetime. Some people are more able to deal with stress, more able to deal with life without looking for some kind of escape. They're less likely to get addicted than the person who needs more support, has a tougher time dealing with situations, has just that kind of personality makeup that makes them more susceptible to addiction.
And what does a parent do in the formative years to try to make it less likely a child could have addictive tendencies?
Well, I think there's a lot of things. You know, providing them a very secure, safe, stable environment, making sure that they're educated very well, also teaching them coping skills. So when something bad happens, we don't look for a quick fix, or we don't look to work our way around problems. We work through them. I think I've seen a lot of parents who trying to do well for their children, trying to help their children solve all their problems for them. And when you do that, they don't learn how to solve the problems for themselves. And that's not a good thing. They need to learn those problem solving skills. And as a parent, you know, we don't want our children to be uncomfortable. We want them to be comfortable and have what they want. And sometimes it's okay to allow children to struggle to figure out how to work their way through situations. Those are really important lessons in those formative teenage years.
Is there one particular book or source that you would go to for someone who is unclear as to whether they're navigating for their children properly?
You know, I can't think of one, but there are several books about parenting. And I think that looking at a couple of them and picking up with the style that works with you and your family, and talking to kids about, you know, I'm not going to get you out of this situation. You're going to have to figure this one out yourself. There are a lot of good resources out there. You know, if you go to Amazon, you'll find a lot of good books on parenting.
Okay. So let me try to find the slide here. Oops, I was using the wrong mouse. Tell us about the DSM-5.
So the DSM-5 is the book that gives us all of the diagnostic criteria for all of the mental health or behavioral health or psychiatric disorders. In those are including substance use disorders and alcohol use disorders. This is the standard book that we use to diagnose somebody with an addiction or a substance use disorder, as the book calls them. The book, I'm sorry, go ahead.
You go ahead.
In the book, it lists the criteria that the person has to meet in order to be diagnosed with substance use disorder. So some of those are here with the guidelines for drug addiction diagnosis. Drugs are taken in larger amounts or over longer periods than intended. And what that looks like for a lot of people is, well, you know, I'm going to go to happy hours with my friends. I'm just going to have one drink, then I'm going to go home to my family and have dinner. And then 3, 4 drinks later, they're realizing that they're still sitting there. Persistent desire, unsuccessful efforts to cut down or control drug use. It can be very simply, well, I'm not gonna drink until the weekend, and then not be able to make that happen. A great deal of time spent obtaining drugs, using drugs, recovering from drug use and effects, cravings or strong desires or urges to use drugs in any form, failure to fulfill life obligations when you start missing work, missing school, missing family responsibilities, loss of motivation and or decreased desire to obtain life goals, an increased tolerance to drugs combined with increased usage to feel the same high. And one of the things I want to say about this is what happens with drug addiction is the very first time somebody uses a substance, whether it be an alcohol or a drug, they get that initial high. The serotonin, the dopamine in their brain just goes haywire, and they have a euphoric feeling or euphoric high. A lot of the times what happens in addiction is that person then starts to chase that initial feeling. So there will never be a feeling as good as that first time. It's kind of like falling in love when you're infatuated. And they chase that feeling again and again, and then they have to start using more drugs and drink more because they're trying to get that feeling back that they had that first time. And it takes more and more and more, and they are never able to achieve that feeling again. At some point in the progression of addiction, especially toward the end of the cycle, it will start taking less because their body is starting to break down, their liver's not metabolizing the way it should or it used to, and it will take you less. So it actually is kind of a bell curve that goes up. It first takes more, and then as addiction progresses and the decline towards death starts, it starts to take less to get that desired effect. You also have here using drugs despite medical advice that it may be harmful to the physical health, and continual use even after multiple legal issues or a result of drug use. And one of the things that we see all the time is, when people come to us and they've gotten their second DUI and they say, well, I'm not really an alcoholic. Listen, if you weren't an alcoholic, you would have stopped after the first DUI. There's a problem, there's a reason. You're going to have continual use and continual behaviors that created the problems, even though rationally you understand that if you drink and get behind the wheel of a car, something bad's going to happen again. The next slide talks about addiction being a chronic disease, and that is one of the hallmarks of addiction as disease. It is chronic. It is a long-lasting condition. It doesn't go away. You can be in recovery. You can be drug or alcohol free, but it's a chronic use disorder that's going to be with you your lifetime.
So how does a trust officer or a family advisor or even a parent keep track of where the beneficiary or the child or the client is in their chronic disease? How do I know that when the client's calling me that they're not drunk and making bad decisions versus that they are doing the right things?
Right. I think it depends on the boundaries that you have set up. It's obviously, I think, easier with a parent than a trust officer or an attorney. But when someone is in recovery and not drinking and not using drugs, all of the things that are going on around them work out. There's less chaos. There are less emergency needs. There are less situations that need to be handled immediately. So I think having some kind of measure of that chaos. And then if you have the ability to drug test, that's the ultimate answer. If within whatever arrangement you have, you can actually have that person be responsible for providing urine samples, that would be the best way to know how.
So I would put in my legal documents that the trustee is required or recommended to have periodic urine testing by a reputable mental health counselor to verify?
Yeah, I think so. Particularly if you can do it on a as needed basis, like if there are concerns about the trustees' um, responsibility or what's happening right now, then we can request that they provide a sample.
What is this concept of dependence versus reliance?
So some of the drugs that are prescribed by doctors are very, very needed. And let's take oxycodone, which is huge here in Florida, for example. Unfortunately, oxycodone is a very helpful, useful drug to people who have real pain, but an incredibly addictive drug. So if somebody's taking oxycodone, as their doctor recommends it because they're going through some radiation for cancer treatments, it works very, very well. At a certain point, they are reliant on that drug because their body has become dependent on it, even though they're not an addict, even though they're not addicted. Their body is reliant on it, and they're going to require some withdrawal from that drug when they no longer need to have it. They can't just stop taking it because they'll go through the same withdrawal symptoms that somebody who is addicted to it will go through. So there's a physical reliance on it, even though they wouldn't be diagnosed as substance use disorder or addicted to it.
I see. I'm going to skip now to page 18. Tell us about detox. What do we need to know about detox?
Well, the first thing you need to know about detox is that without it, somebody can die. I think a lot of people will be surprised at the most dangerous drugs to detox from. The most dangerous drug to detox from is alcohol. There is more of a chance of someone dying from alcohol withdrawal than from heroin withdrawal. As a matter of fact, heroin withdrawal is very safe, as is oxycodone and fentanyl. Now, the person will feel like they're going to die, but they're not going to. They're not going to have a seizure. They're not going to go into respiratory arrest. When you're talking about alcohol or benzodiazepines, which are Ativan, Xanax, Klonopin, Librium, those drugs are very dangerous and require the person to be in a hospital, someplace where they can be weaned off of them safely so they don't go into cardiac arrest or have a seizure.
And are most detox centers safe, or are some better than others? How would you choose one?
Well, I think some are always better than others. You want to make sure that the people, whoever provides treatment, detox or any level of care, are licensed to provide the level of care that they're providing. So most detoxes in our area are done in hospitals, usually 3 to 5 to 7 days length of stay. You want to make sure that it's a good facility overall, that they get good reviews, that they're Joint Commission accredited and licensed by the state of Florida.
Okay, and then how long does detox normally last?
Again, depends on the person, how long they've been drinking or using the substance. I would say an average of 5 days. Average of 5 days.
Okay, and what does it cost?
Usually around $1,000 a day.
Okay. And can people detox and then just go home and they're better for a while?
Well, no. A lot of people unfortunately try that, but detox isn't treatment. Detox is simply withdrawing the body from the alcohol or the drugs. It's not treatment. So after detox, they need the support of treatment to stay in recovery. They need to see a counselor. They need to be in group therapy. They need to start going to AA meetings. They need to start looking at those underlying issues that drive their drinking or drug use. And treatment includes a lot of things. It includes education, family counseling, couples counseling. It includes follow-up care, medication management in case the person might need some psychotropic medications, a lot of individual and group therapy, and very importantly, referral to support groups, because even after the treatment ends, recovery continues, and those support groups are paramount to somebody's success in addiction recovery.
So how long would a full-time residential treatment typically run, and what are the success and failure rates?
You know, I think all the research shows very clearly that the longer somebody is in treatment, the more likely they are to stay in recovery. So you want to get them involved in a treatment program that has many levels of care. So you want to start with the residential level of care. I would never suggest any less than 30 days. 60 really is optimal. And then you want a step down in level of care. So after residential, they're in a less structured, less restrictive level, like intensive outpatient, where they're only coming to the treatment center 3 nights a week for 9 hours of group therapy per week. And then after they complete that for 2 or 3 months, then they start doing maybe some individual therapy where they're going to see a therapist once a week. Also doing some aftercare groups with the treatment center is very helpful, and always going to AA meetings or NA meetings almost on a daily basis or whenever they can.
Okay, and what kind of addiction counselor do you look for? Are there credentials? Are there reviews? Do you want to go to a psychiatrist? Do you want to go to a psychologist? How does all that work?
Psychiatrists are for clients who need some kind of medication management for depression or anxiety or some other co-occurring illness. They don't provide therapy or addiction counseling. You want to find somebody who's a licensed mental health counselor or a licensed social worker who has experience in addiction. The state of Florida has an organization called the Florida Certification Board. They also certify addiction professionals. So ideally, you're going to have somebody who has a licensed mental health counselor from the state of Florida, as well as a certified addictions professional from that Florida Certification Board. A lot of times in our industry, unfortunately, people have thought that just because they're in recovery themselves, that they can then help another addict. And they can in AA meetings, but to provide professional help and therapy, you have to have somebody who is professionally trained. Now, having said that, the combination of those two can be really powerful. To have somebody who's educated, licensed by the state, and in recovery is very powerful for clients when they come into treatment because they see that person as a professional, as somebody who's overcome their illness, but they can also relate to them about what it's like to go through that process.
I see. What if somebody, well, actually, let's talk about outpatient care. So
Okay.
somebody goes into a rehab center, they're there for 60 days or 90 days, they've established a good baseline, then they come out, and I have seen that people say, okay, I'm done, I'm good now, nobody pays attention to them, and they fly off the grid again. So what are the outpatient protocols that a trust officer or a family lawyer or somebody else would want to make sure is in place when somebody comes out of residential treatment?
I think having that outpatient therapist that they see once a week or even once every 2 weeks or once a month once they've been in recovery for a while as a check-in point, as somebody who can say, listen, we know this person's still on the right track. We have a lot of pilots who come to our aftercare group through the FAA, and we provide them with letters for the FAA saying, yes, we can tell they're doing the right thing, they're still okay because they're coming once a week or twice a month to the aftercare group. And you can tell a lot by looking at somebody and having a conversation or a group with them a couple times a month. So we can say, yes, it looks like they're still doing well, they sound good, it sounds like they're still doing the right thing. So having that kind of check-in person on an outpatient level, I think, is very important.
Okay. Now, what about a halfway house? What should we know about halfway houses?
So the first thing you want to know is that there's a new accreditation in the state of Florida called FAR, and it certifies sober living houses or halfway houses, recovery residences is what they're calling them. It's an association for accreditation for recovery residences. You want to make sure that if you're sending somebody to a halfway house or sober living, that they are FAR accredited. And you can tell that by Googling. If you Google FAR, it'll give you a list of accredited halfway houses in your area. This is the first time in the history for Florida that we've ever had an organizing body accrediting and overseeing and evaluating and doing inspections. So you want to make sure that you're using that organization and finding a house that is FAR accredited. So halfway houses are very structured living for addicts early in recovery. There's no treatment that happens at them, but there's structure and accountability. So there's a curfew, there's requirement to attend AA or NA meetings, and they do random drug screens on the people. They have house meetings once or twice a week, and they're expected to go to work or to school. So they have to be engaged in some kind of full-time activity, going to their meetings, providing urine screens, and going to the house meeting once a week. It gives addicts in early recovery the structure that they need to stay safe. You know, one of the paradoxes of addiction is that addicts repel from structure. They don't like it. But in it, they thrive, and they feel more comfortable. So if you can get somebody into that structured environment, it will benefit them greatly.
And how long would somebody typically be in a halfway house after 60 or 90 days of rehab treatment, of residential
You know, it really
treatment?
depends on the person, the living environment, living situation. I would say a minimum of 3 months, but I have known people to be successful there for a year. You know, it's not as restrictive as it sounds. You can live very comfortably there because all you have to do is do the right thing anyway. So I've known people to stay there for a year, but a minimum of 3 months.
Okay. What can you tell us about the 12-step program? I know from experience with many clients that it has been they feel it's been very effective for them, and it's become a very important part of their lives.
Absolutely. It provides them a lot of things that they need to have that structure and that accountability. So there is a sense of accountability in the rooms of AA. There's a sense of community, so that people going to meetings, they don't feel like they're alone. They know that there are people there who understand the way they think, the way they feel, and can help them walk through that process. Everybody in AA is encouraged to get a sponsor, which is that mentoring piece. That's somebody to walk them through the 12 steps of the 12-step program and to help that person get going in their early recovery as they did themselves. And it gives them a very safe social outlet. One of the things we tell people when they come into treatment is they've got to change people, places, and things. You can't hang out with your old friends and go to the same places you went to when you were in your addiction. So it gives them a new social circle to really get that support from and to participate in sober, fun activities with.
Okay, so now let's talk about some things that I think you felt are questionable, to say the least, beginning with methadone.
Right. There's a model of treatment out there called harm reduction. Methadone treatment, Suboxone's the newest methadone, and there are a lot of people who really believe that this is the answer. It's not the answer. Methadone, Suboxone, people are still addicted to that substance. They still need to get that substance from somebody, somewhere. It doesn't solve the problem. It doesn't help the person work through their issues. They're still dependent on a drug. So a lot of people will take that easier, softer way and would say, well, I'll stop using heroin, I'll just go on Suboxone. Well, that's great, but unfortunately, you're still addicted. You still need to get that Suboxone. You're still going to have physical withdrawal if you don't have it, and it's still going to cause problems in their life.
Okay. How about economic incentive programs? Can you pay people to get off of drugs and alcohol?
Yeah, those don't work with addicts. Addicts will find a way around this system, so they're very, very skilled at working the system. So I have never seen or talked to an addict that got well through any kind of contingency management program, any kind of I'll pay you not to use drug program. These kind of programs were really kind of set up from the sociological perspective, from that larger society. How do we control this group of people, as opposed to looking at the individual with the problem and trying to help them overcome the problem.
I see. So are there addiction counselors who could help a trustee or a family advisor verify that a person is doing the optimum thing, or the things that should be done to reduce their addiction issues and to help show that they are functioning properly in society? Is this something
Absolutely. If you look for the Florida Certification Board, you can look for people who are certified through the board as addiction professionals, and also find one of those that's also licensed at the mastered level with a licensed mental health counselor. That would be the perfect person to do that.
Okay. And is it true that a lot of the rehab centers are run by counselors, operators, and owners who have had addiction issues?
It is true, but make sure that before you use one, you also make sure that they have the proper education and training and licenses.
Okay. All right. So, Robin, how would you sum this whole thing up? We've got some viewers here who've been listening to us for half an hour. What would you say to lawyers, CPAs, trust officers who are trying to help families with these issues, and in some circumstances are responsible for determining how and when to use the family money to handle these issues, or to basically, quite candidly, support someone who's not going to work and who has addiction issues? Where do we go? What do we do?
I think the most important thing is education. Educate yourself about addiction. Educate the family members so they know what they're dealing with. Help them find somebody in the community who can help provide them some guidance, whether it be Al-Anon, which is the 12-step group for families of alcoholics, or an outpatient therapist, or do a lot of reading. But educate yourself about addiction so you know what you're dealing with, because they don't teach us how to handle addicts as part of growing up and in the family systems. That's not something that they know instinctually. You have to be educated about what's going on so that you can provide the best care.
And Robin, one thing you've taught me as I've sent you some families over the years is it's not only the most addictive member of the family, but it's also how the other members of the family enable or punish or torment or even feel about the whole situation. It's a family affair.
It's definitely a family illness, and families unknowingly can really contribute to the problem of addiction without knowing that they're doing it. They can be thinking they're doing what any loving parent or family member would do, but they're really contributing to it, because addiction is its own monster, and you have to know what you're dealing with before you make those important life decisions.
Okay. Well, Robin, thank you so much for coming today. We invite everyone who has seen this webinar to email me. I'm sorry I don't have my email address up here. Gassman, AGASSMAN, @gassmanpa.com. If you have any questions, comments, or suggestions for future programs, and I'm sorry, Robin, what is your email address?
My email is rpiper, Piper, @tpoftampa.com.
Beautiful. Robin, thanks again. We really appreciate not only what you've done today, but what you've done for so many different people with challenges and their families. You do a great job, and we really appreciate it.
Thank you, Alan.
All right, Robin, very good. Thank you very much.
All right, awesome. How'd I do?
You did great.
All right.
Fantastic.
All right, good.
Yeah, if you want to ever do another one of those like that on any subtopic, just let me know.
All right, will do, honey.
All right, you take care.
You too. Bye-bye.